Hey, good morning, Dr.
Good morning.
A.
Good morning, Dr. Saylor.
Casey, how are you doing?
Good, how are you?
Good. Hector?
Top of the morning, sir.
So, I'm Dr. Larry Saylor,
I'm Dr. Michelle Afonso.
and we're going to talk about what we just recently came back from in Miami, which was the
Apa Symposium.
Apa Symposium. And I would like to start with why we were there and, why we determine or decide to spend time and a lot of money outside of the office doing these symposiums or doing this continuing education. And I think traditionally dentists go because you have to have a certain amount, right?
Right. There's required continued education hours.
Right.
But that's not why we went.
For us, the way we look at it is we have different lines of business that we have to service. And these are very particular to our brand that we decide is nice to be able to offer patients to provide them. I mean, I guess if you were to say the cornerstone of our practice is cosmetic and comprehensive dentistry. But within that umbrella, we offer
Endodontic treatment.
which are root canals.
We on bread and butter dentistry, which we call, those fillings, crowns, things that you would see more in your everyday dental
Right.
office.
Invisalign,
Invisalign.
TMJ, diagnosis and therapy,
Whitening, was just cosmetic.
BioClear, a lot of cosmetic dentistry, which is veneers and cosmetic bonding, which is strictly what we call C needs, that if you didn't do it, it would be okay. But cosmetic dentistry is all about something subjective, that you desire a better smile. Not that it's not healthy, but you desire a smile that has been improved. Where comprehensive dentistry is more dealing with, over time, your chewing surfaces get altered, your bite gets altered, and the teeth are no longer able to function in harmony, and you have to restore that harmony again in a comprehensive nature. So these are the different lines of business that we offer, almost like Starbucks offers different products, right? And the difficulty of being able to offer those different lines is we really feel like we have to be able to offer the best. If we choose to do something,
Right.
we want to be at the forefront of that. And so we seek out the best continuing education so that we can stay relevant, and not only relevant, so that we can offer a world-class service. And so that's what the Apa Symposium was. Mike Apa, do you want to talk about who he is?
Yeah. Mike Apa he's a dentist at the forefront of the field. He has 4 offices located in the United States and in Dubai.
And in
so
Dubai,
he's international. And I think how you appreciate Mike Apa is to understand where he came from. Because with his background, he had a mentorship. He started with another dentist who is renowned in his field, Dr. Larry Rosenthal, which you studied under.
And that's who I started with, was Larry Rosenthal in 2000, where the beginning part of my career from 94 up to 2000 was dealing with occlusion or dealing with how to fix somebody's bite and how to do comprehensive dentistry. And that was Dawson and Pinky, Coyce, Frank Spear, which are all top names in the field when it comes to the precision of getting somebody's bite right.
Right.
And I started dabbling in cosmetic dentistry in 2000 with Larry Rosenthal. And I think the neat thing about this weekend was it was so neat to see that even that it's been since 2000 where I started, and that I continued with your generation, which is Mike Apa, those things that I learned back then are still relevant today. But there were a lot of nuances between what I learned with Larry Rosenthal and then what I learned with Mike Apa that we'll try to talk about. And as with anything, if you want to bring it to the highest level, it's all about the details, isn't it?
Yeah, editing.
It's the editing. It's how you choose the perspective that you may have, the little touch that the human touch you may put on it, and how your brain perceives something. And that is part art and it's part science. So what we'd like to do is give you a little taste, if we can, of what we gleaned from this weekend. So it was in Miami, a world-class city, and I was very impressed with the group of dentists that were there. I mean, I was one of the oldest guys there, which I was happy, to be. And it was neat, this group of younger dentists.
International,
very international. We're a cool group of dentists. I mean, made me very proud to see a group of my peers that were very professional, very well spoken.
Yeah, focused on clinical excellence and doing everything they can for their patients.
And that was a great thing, is they were really into their craft. And it's great to see dentistry like that, where dentists are happy to do what they're doing, and they really understand that with the skill that they're learning, they're able to change somebody's quality of life with what we're doing. And that's exciting. And everybody was very passionate about that, and it was pretty obvious. So let's talk about what was one of the first things that you were able to pick up on. Again, we're talking about little nuances.
Yeah, so this is the Apa Symposium, and they have the larger name Apa Aesthetics, which is through Mike Apa. This is everything he's built. And so he was the lead speaker in this course, and one of the biggest takeaways was understanding how he sees things. So what we talk about is, for an artist, you can say an artist has their aesthetic eye.
Yes.
They're able to see things, how the colors should come together, the composition of a painting. And Mike Apa has that aesthetic eye in cosmetic dentistry.
Right. Which is, I mean, I think any of us that have gotten into the cosmetic end of dentistry, people would say, oh, that makes sense because you have the eye for it. And, to try to figure out what that means. What does that mean when you have the eye for something? And I think what it means is you can look at something and say, oh, that picture's off by just a little bit. Or I love the line of those pants with that shoe. Or I love the color combination that particular piece of art has. Or even the arrangement of those flowers look particularly aesthetic. That is an eye. And, everybody has an eye, but some people have a really, really good eye. And what can become daunting is if you feel like your eye needs developing, can you do that?
Yeah, it's training, and I think it's reps. And it's learning from people like Mike Apa, who, in the best way he can, which is not an easy thing to teach. He teaches what to look out for, and teaches you a little bit about having that eye.
So in particular, we were looking at cases where he was showing us how he balances and harmonizes the smile with the face. So we're looking at cases where everybody has like a strong side and a weak side, right? Where they like to, in a photo, say, okay, get this side, or they pose a certain way because they intuitively know that there's asymmetries. And over time, these asymmetries that are developed from function and development of the face can be accentuated in the teeth. And as time goes by, the teeth can become off and not harmonize with the face. So we're learning more and more how to look at the face and balance the teeth with the face so that it brings back that flow. And again, these are all artsy terms that are like, what are you talking about? But we all know when it's off and when it can be reset, where you look at it and go, okay, that's right. And you feel it here and you feel it here. It's like, let me do this. And literally when I see Apa do these things, he's adding little teeny pieces of composite to a provisional. And then you look at it, and in the beginning, he would always say, okay, so that's right. And I'm like, what did he do? He didn't do much. But when you look what he's doing, he's controlling the outcome of that aesthetic case. So he's being able to communicate with his hands and his eye to the lab what he would like them to be able to provide so that he's in control of the case. So I think that's the first thing that we picked up on. And when I was so excited because I'm watching him, I'm like, you see his eye, how good it is? And I had talked to Dr. A about it for so long, and she's like, oh yeah, I see, I get it. And we were seeing that these little differences that he's making, and he does it all with flowable, right? So the way these things work is you're looking at, you're diagnosing how long you want the teeth to be, how many teeth you want to do. Do you want to do 8 teeth? Do you want to do 10? Do you want to do the bottom teeth? And, you know, once you do that, you give a prescription to the lab so that you can do a wax up. And then you're going to take a model of your teeth, you're going to add wax or virtually add what is missing from the teeth in a virtual way digitally. And then you get this back, you try it into the patient's face, and then the dentist has to edit. And that editing process is what we're talking about. That makes a big difference.
Yeah.
So that was outstanding to be able to see, and it's always something that you're developing and honing.
Yes.
So what was another thing that you picked up on that was the Apa difference?
Yeah. The Apa difference is the choice of color.
Yes.
That's a big conversation for any cosmetic case. The color. And
Yeah.
patients come in with a thought of what kind of color they want, and we have these conversations a lot. And he presents it in such an amazing way.
Yeah, I notice when I'm looking at his cases, it's like, gee, the teeth just look real. The way that the light plays with the porcelain, and I think part of what's so nice about it is the light penetrates the porcelain, and as natural teeth do, and you can see different colors. You can see different layers of translucency, and you can see depth to the restorations, textures, line angles. But the color has a certain distinct feel to it. And in my head, I'm thinking, how does Mike Apa get patients to agree to doing these natural colors? Because the fight is always,
I want the whitest possible teeth.
yes, and it takes all the artistry out, right? It's like, sure, we can make it. It's a matter of picking, Casey. Just here is the darkest, here's the whitest. I want the whitest. But as anything, I mean, salt makes food taste better, right? But does more salt make it taste more better? No. So more color doesn't make it, or I should say more whiteness, because color, when we look at the primary part of color, it's value. And value is the amount of whiteness. So you have value that goes from, in dentistry, from 5 up to 0. 0 has the most amount of whiteness. But as you get more white, you lose the nuance. You lose any amount of color. And it appears out of harmony. Because now you have a set of piano keys. And it's funny because people say they don't want piano keys, but when it comes down to picking the color, they push and they push and they push. And I'm thinking, this is a management part that we have to deal with. We have to help coach the patient on how to choose a color that's appropriate, that is going to create harmony.
Right.
And so we took a deep dive into how Apa deals with color. And that has been the trend that he set. And what he says is he doesn't let the patient choose. I mean, he's been able to get to that level where he can say that. I wish I could say that I didn't let the patient choose, that I chose the color. In reality, yes, the patient has to help choose, but we have to be able to put the governor on and say, you may not want to go with the OM1, and try to bring that to a level that is harmonious with what they're trying to achieve. So we spent a lot of time with that, and I gained a lot of insight into how he achieves these colors. So color is one thing. What's another thing that we looked at with him that was another part of a clue to his success?
Another Apa difference. It's the material choice.
Yes. The material choice, of course. It's like these tools that we work with, it's up to us to really understand, because when you're coming in asking for a better smile, gee, how many choices are there to do that? And you're expecting us to be able to connect you with the right choice, which is, in this case, when it comes to veneers, gee, there are today, I don't know, maybe 20 different types that you can use. And so to understand what the world's best is using and what we can offer our patients is really important.
Absolutely.
And so when I first started with Larry Rosenthal, we were, just to give you a little bit of insight into the different types of materials, there was feldspathic porcelain, and then there was a newcomer called Empress, and everybody got excited about Empress. And then there was, shortly after that, about 2 years after that, there was Emax. And then everybody got excited about Emax. And the nice thing about Emax was what?
It had a strength to beauty ratio.
Yeah, so it was strong and it was beautiful. Whereas we started putting a lot of Emax cases in, and I felt like, geez, it doesn't seem to be as pretty as what I remember the OG, which was feldspathic. And we've all done that before, right? Where you jump onto something new, and then in the back of your mind, you're thinking, I think I preferred the older Levi's versus the Levi's of today, right? There was something intangible about it that was more authentic and nuanced. Well, the same thing with Emax versus feldspathic. And it turns out that the world's best is using feldspathic. And this has gone on quietly, because we're all looking at this case and just assuming it's Emax. And I'm like, this can't be Emax. It has way too much depth to it, complexity to it. And what's the difference between the Emax and the feldspathic, basically?
The Emax, they call it monolithic. It's one layer, so it's one color.
Yeah.
The feldspathic is layered. So they are in the lab working layer by layer and adding those nuances,
Sometimes
adding that depth.
18, 20 different types of tints.
All within that restoration,
Right.
which is where that depth comes in. So why for the feldspathic has that nuance of something different.
It's stratified. And if you were to look at it, and we did this, he seeded a case that one set of veneers, and I think in this case there were 10, was feldspathic, where the first set was Emax.
Yep.
And then we tried it in with feldspathic in one shade, and then we tried it in with feldspathic that was a little bit, turned up the volume, even more white, less color. And then the experiment was, as he put the first set in, he's like, how many people love this? And we were all like, this looks gorgeous.
Right, which is the Emax.
Right, it looked fantastic. Then you put the second set in, and you're like, whew, God, I think that looks even better. And then you put the third set in, and you're like, that's really nice.
Yeah.
But I think I like set 2. And so the majority of the people in that room liked the second set by just a teeny bit more.
Which was the feldspathic.
Which was the feldspathic that had more color. And then he said, well, see, that's my favorite set as well. But the point is, you guys have all developed your eye where you can see that. You don't know exactly why. And the difference is so teeny. But let's face it, some of our patients out there have that artistic eye too. And so if you happen to have that, you may require this. But what's the downside about the feldspathic?
That strength, I mean, it's beautiful, but for somebody who maybe is a clincher and grinder, more functional risk, that feldspathic has a risk of chipping.
Yes, so for a lot of my patients that are coming in, they've worn their teeth down, for sure I'm not using feldspathic in the back. But in the back, you're not looking at those teeny details, but maybe in the front, we could give them that in the front and put the strength in the back. Or if somebody's practical and they're like, you know what, doc, I don't see the difference between these. Why wouldn't I just go with the stronger material? I agree. Go with the strong material, sleep at night. Or some that are gonna like split hairs, it's like, all right, listen, I can see you're having a hard time with this. You can go with the feldspathic, but
you run the risk of maybe some chips and a bite guard or a retainer.
Yeah, and what happens if it chips?
You have to redo it.
Yeah, you have to redo it.
There's no repairs, so you have to redo.
Right. You can't just add a little bit back. You have to redo the veneer or the crown.
Yeah.
So that was nice to be able to see and to deal with that stratified look, that complex look of these different tints and whatnot and levels of translucency. Feldspathic is something that I want to work more and more with. Again, now it's like getting the labs to do more of that because everybody's moved to Emax. What about a third thing?
You brought it up right here at the end, the lab. That's absolutely something that Apa and his team have honed in. It's the relationship they have with their lab, which is different than your typical office because they have in-house labs.
Right.
They have the
Apa
technician.
does, yeah.
Yes. But it's a communication and a relationship with the lab that really makes a difference.
So our lab that I've been working with for the last 30 years is the unspoken partner in the room when we're choosing to do a cosmetic case. And I have a great relationship with the lab. But to the level that Apa has with his lab, I need to have an even better relationship with my lab because the game that we play is you're giving information when I first see you, Casey, to do your smile. I'm giving information to the lab on what our vision is of the case. From my eye, from my learning, from the analytics that we're taking in, we're making decisions. We give this information to the lab does their best to create this vision on a model, whether it's virtually or in wax. Then now the dentist takes the baton again, we put it in the mouth in the way of a mock-up or a set of temporaries, and then what do we do to that?
We edit it a little bit more.
We edit it
in the mouth.
A little bit more by using, now we have the advantage of what? That the lab doesn't.
The face.
We have the advantage of a living person in front of us that moves and has cheeks and that has a certain dynamic to their smile and a certain dynamic to their personality that the lab does not. So you have to edit again. And now we take that editing and we have to give the baton back to the lab. Now the lab has to recreate that in whatever material that you choose. And then before they hand the baton back to us, we have to look at it and approve it. And then when we get it, sometimes we have to edit it again in the porcelain. So this dance is very intricate. And it is nurtured by communication and tools today of digital and great photography and video and proper lighting. Then we have a chance at making sure the vision that the patient and the doctor had formed with the lab comes to life in the mouth for this very nice investment that you're making in your smile. So that we learned some keys on better communication with our lab.
Absolutely, yes.
So those are what we spent our time doing and why we decided to do that, and ultimately, what is that going to make a difference in? I mean, how does that help?
I mean, learning all this, because we don't like to take time from the office.
Right.
Right. We choose these courses like the Apa Symposium and these events specifically to bring back something valuable to our patients in our daily practice. So the aesthetic eye, the choice in color, the material communication with the lab, and all these things that we learn are nuances that we can implement.
And we can bring it back to Brandon and offer world-class dentistry in Brandon, because we're rubbing shoulders with the best in the world. You know, in the conversations that we have with the dentists at lunch and on breaks, and we're bringing this information back because we're excited about what we do. We like to be good at what we do. We're very passionate about what we do, and what we do, if we do it well and create excitement for you and quality in your life, then that keeps the whole cycle going. And that's what we wanted to communicate to you, is exactly how we spent this last 3 days.
Yes.
So, thank you very much.